Assalamualaikum warahmatullahi wabarakatuh. We are from Group 6 from Class U in Economics Education 2019. Now, we are going to present about our journal, and the title of our journal is The Potential Impact of an Implemented Income Redistribution Package on Obesity Prevalence in New Zealand. The members of our groups are first, Budi Santoso, and the second, Citra Andhika Kristi, and the third, Novi Puspita Sari. The keywords of our journals are income inequality, Guinea, obesity, families package, New Zealand modeling, policy, and redistribution. The aim of this journal: this study quantified associations between absolute and relative, individual income, and obesity prevalence. These associations were then used to model the potential effect of a New Zealand government's income redistributive policy, the Families Package, on adult obesity prevalence. And the methods: logistic regressions were used to investigate associations between absolute individual income and adult obesity prevalence in New Zealand. Linear regressions were used to assess associations between relative income or income inequality measured by Gini and obesity prevalence from the NCD-RISC for OECD countries. And the result? Absolute individual disposable income was significantly associated with obesity in New Zealand females but not males in a shallow, inverted G-shaped fashion. Income inequality was significantly positively associated with obesity prevalence in New Zealand females but not in males. And the conclusion of this journal: despite being the most substantial income tax package in New Zealand since the 1990s, this policy had a modest effect on income redistribution, and its expected impact on reducing obesity in females was also modest, with no effect in males. Introduction. Research background. The consistency by which socioeconomic status is associated with well-being has led numerous researchers to call for political action to address the social determinants of health. It is challenging to model the health effects of policies amending the broader social determinants of health, and few studies have attempted to do so. Disposable income is influenced through tax rates, minimum wage levels, and social welfare, making it the most immediately amenable component of socioeconomic status to policy intervention. Problem of the research. Socioeconomic status produces a gradient of health that is observed for a diverse range of outcomes, including life expectancy, mental, physical, and even perceived well-being. The consistency by which socioeconomic status is associated with well-being has led numerous researchers to call for political action to address the social determinants of health. It is challenging to model the health effects of policies amending the broader social determinants of health, and few studies have attempted to do so. Disposable income is influenced through tax rates, minimum wage levels, and social welfare, making it the most immediately amenable component of socioeconomic status to policy intervention. The aim of this research: the study aims to model the potential effect of an income redistribution policy on adult obesity prevalence. To date, there is insufficient experimental evidence of the impact of income tax interventions on health. This study models the potential effect of proposed mechanisms on adult obesity prevalence, such as the absolute income hypothesis and the income inequality hypothesis. The next is about research question. Question number 1. What is the relation between absolute and relative income with obesity prevalence? Number 2. What is the potential effect of income redistribution resulting from introduction of the family package on obesity prevalence in New Zealand? And number 3. What is the impact of obesity prevalence in adults and income redistribution intervention on health?
Okay everyone, my name is Citra Kristi and I would like to explain about the method of this research. Sex-specific logistic regressions of cross-sectional and the HS data were conducted to ascertain the association between absolute individual disposable income and obesity prevalence. Based on this modeling process, the equation of the final model was below, which P as baseline, AH ethnicity, I income, HC means household composition, and I multiplier with HC means the interaction terms between income and household. The results were expressed as potential preference ratios or PPRS and calculated with using the NO estimate macro. So there is a schema from the journal that told us about the sources of the data, the method of the data, and the output of this data. So the sources of the data, the first is New Zealand Health Survey, Household Economic Survey, World Income Inequality Database, and NCD RIS. The midpoint for the open-ended income groups were estimated using weighted population. Each person's income before and after family's package was input into these equations to calculate PPRS at status quo and after the family's package for each HES participant. A potential impact fraction or PIF was calculated using the RRCF method. The PPRS were weighted to the general population using the PIF formula described below, where P is the proportion of the population with a specific income derived from the population weight generated by the TAWA model, and PPR was estimated using the trend line equation. SQ and families package represents the prevalence at status quo and a response to the families package respectively. Sex-specific linear regressions were conducted to ascertain the association between income inequality and age-standardized adult obesity prevalence in OECD countries. The Gini coefficient used in this analysis is calculated using the disposable income of adult individuals. This is likely to capture social injections such as the gender pay gap. The final model was below, which is X1 means Gini, H2 means GNE per capita, H3 means FDI, H4 means education index, X5 means total healthcare expenditure, X6 means ethnic fractionalization, X7 the percentage of the populations living in urban areas.
Result of the research: first, the family package has little effect on an individual's absolute disposable income and income inequality in New Zealand. Second, there is a shallow inverse G-shaped relationship between an individual's absolute disposable income and obesity in women, a relationship modified by household composition. Third, relationship between an individual's absolute disposable income and male obesity has been modified by age and ethnicity. Fourth, there is a statistically significant positive relationship between income inequality and the prevalence of obesity in women. A positive association was also observed in males but was much weaker and prone to outliers. The 5. The influences of the family package on the distribution of relative income is estimated to have a greater influence on the prevalence of obesity in women than change in absolute income. 6. The family package may have a modest effect on the prevalence of obesity among adult women in New Zealand. The conclusion: the family package is expected to result in a slight reduction in the prevalence of obesity in women. A shallow inverse G-shaped correlation was observed between an individual's absolute disposable income and obesity in women, and positive relationship between Gini derived from the individual's disposable income and the prevalence of obesity in women. There is no evidence for an association between inheritance of income distribution and obesity in men. Interestingly, the obesity preventive effect associated with predicting change in income inequality was greater than the effect associated with change in absolute individual income. There is also the potential for additional income, especially when it is not sufficient for men to significantly change the circumstance of low-income groups to increase their prevalence of obesity. Policy recommendation. The policy that can be applied in this case is to redistribute income as one of the steps to maintain public health from obesity, as in the case above is the mandatory policy of buying and consuming healthy food provided by the government, and healthy food can be sold cheaply or given for free to people with weak economies for equal distribution to the community. Our point of view about this journal: the weakness. In the introduction, the variables are only briefly explained. Second, in the introduction, the problems contained in this study were not discussed in depth. The strength, the data that is the source of reference in this research is diverse and can complement. Second, discussion, topic that combine two disciplines of science, that is economics and health. Thank you for your attention to our presentation.